This morning, the CDC is confirming a person in Northern California has contracted the coronavirus, but that patient never traveled outside of the country or came into contact with another person who was known to be infected. Why might that be a big deal? Because it's the first sign, say experts, that the disease may be spreading within a local community. There are now 60 confirmed cases of coronavirus in the U.S., but so far, there have been no deaths here.
Because of all we've done, the risk to the American people remains very low.
On Wednesday, President Trump, flanked by public health experts, was downplaying the coronavirus threat.
We're very, very ready for this, for anything.
The president also appeared to contradict a CDC warning from earlier in the week that an outbreak in the U.S. is all but inevitable.
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level or it could be at a larger level.
Health officials say the situation is fluid.
Our containment strategy has been working. At the same time, the degree of risk has the potential to change quickly, and we can expect to see more cases in the United States.
The president also says he's tapping Vice President Pence to head up the administration's coronavirus response. Since airport screenings began, Atlanta Airport says 200 travelers who arrived from China have been under home quarantine. So far, none have required hospitalization. Meanwhile, at the University of Nebraska Medical Center, the first human trial for a coronavirus treatment is underway. The first patient, one of 14 cruise ship passengers from Japan, now undergoing treatment in Omaha. Eventually, 400 patients will be in the trial worldwide.
We want to really catch these patients nice and early to give them the best chance to have the positive effects of any treatment.
But any vaccine could be 12 to 18 months away.